So, with the March 31st deadline looming, surprise, surprise, we're learning more about Obamacare problems. Insurance officials now say Obamacare-related premiums are set to skyrocket in the coming months. And get this is really sad. Many top cancer hospitals will now be off limits on Obamacare plans. That is unbelievable. Joining us now, Dr. Bill Grace. He's the founder of Grace Oncology and an attending physician at Lenox Hill Hospital in New York City. Forbes opinion editor, Avik Roy. He's a senior fellow at the Manhattan Institute. And Steve Moore of the Heritage Foundation is back with us. Avik, some people are saying, I don't know if this is true, but some people are saying the Obamacare exchanges insurance for sick people, let's take cancer patients, are taking out medicines, which are very important, that the list of medicines and drugs that are covered by Obamacare is also being narrowed down so that cancer patients, for example, can't get what they need. Is that true?
This is not, it's true, but it's not as pernicious as I think a lot of people are saying. In a market where people are shopping for insurance plans competitively, a lot of people are going to choose plans that have lower premiums and therefore have narrower networks of physicians and hospitals that are lower cost and narrower choices in terms of the drugs that are available. That's what a market would do. Sometimes if you want to go to the fancy MD Anderson or Sloan Kettering, the very top places, you should have to pay a higher premium. And in fact, remember, these are taxpayer subsidized health plans. So actually, the fact that this is happening, this is a rationalization of the market in which the taxpayer is being protected from higher costs. So look, the key is you should have the freedom to choose a plan that covers all those things, and you pay more for it. But the taxpayer shouldn't have to foot the bill for that.
Right. In many cases, that's my objection. In many cases, there just isn't enough choice. It isn't enough choice. I mean, a cancer patient, for example, is going to try to do what he or she can do, and they'll get what they get, but they should have choices. And I don't think they have many choices here, because all these Obamacare plans, it's basically the same plan, just the financing is different. Yeah. I mean, that's always been the case.
Steve, by the way, don't forget that the most important Obamacare plan is Medicaid. And Medicaid is the world's worst insurance system, right? Absolutely. And it's a system that, you know, you mentioned all these hospitals and so on. I mean, you've got to mention Mayo, which is the #1, treatment center in the world. And Mayo Clinic doesn't take Medicaid. So what kind of favor are we doing for these folks?
This was just cancer, but you're right. Look, Medicaid, is a downgrade program. Right. A lot of people say Medicare. The policy intention of Obama is to make that like Medicaid Plus, and a lot of people say the Obama exchanges is to make it very similar, so you have a kind of uniformed, dare I say it, single-payer state-run system.
Well, the other big story here is we're getting very close to the March 31st deadline, right? 7 million people were supposed to be signed up. Kathleen Sebelius said if we didn't get to 7 million, this would be a failure. Right now, we don't know exactly. We're somewhere between 4 and 5 million, but 20%, as you said, 20% of the people who, quote, signed up for Obamacare, guess what? They haven't paid any premiums. If you haven't paid premiums, you're not signed up for insurance. So the number is probably half of where they thought they would be right.
They're never going to make it. They're never going to get March 31st. Between the exemptions and the hardships and all the other stuff they're doing, they're going to waive that. That stuff comes right before the election. They're going to waive that.
The sweet spot, Larry, is going to be in the spring, in the late spring, when these people start to analyze all the people who didn't sign up, all the young people who didn't come in there to lower the cost of this, and the premium is going to be unbelievable. You're going to see sticker shock like you can't believe.
I thought this was going to bend the cost curve down.
How big is it? How big are the premium hikes going to be?
So it's going to
nationwide.
It's going to vary widely. I mean, what the average is going to be, we don't know because we don't have enough data to collect. But easily, it's going to be double digit. It might be 20% on average. It might be 40% on average. In some places, it might be double or triple, as some of the reports show.
All right, Sebelius says that it'll be a lower increase than we've had in past years.
That's ridiculous. Totally ridiculous. And it was actually amazing that she said that in testimony to Congress, because she's setting herself up to look ridiculous when the actual data comes out. We'll know that data before the election in 2014.
Okay, so premium costs, these are insurance companies that need this revenue. Young people aren't signing up, only 20-25% of young people, so that raises the expense. Correct me if I'm wrong. But if they renew cancel policies. Isn't that expensive? They have to go back and redo a lot of stuff. Doesn't that cost them a lot of money?
Yeah, so the people whose plans were canceled, some of those people are being allowed to continue those old so-called grandfathered plans, but they're being charged more for that. So those plans are still going to cost 15, 20% more than they did before, but because they're staying out of the ACA exchanges, the exchanges are getting more expensive. That pool is going to be sicker, and it's not going to be a death spiral in the way that a lot of people are worried about, but it's going to be kind of a zombie spiral because you're still going to have a heavy bias towards older and sicker
there may be
patients.
individual mandate is dead.
Yeah.
Yes,
Dead.
they've
I don't
already
care what anybody says. The individual mandate is dead, and the guy who buried it was Obama.
That's right.
All right, it was his extensions and his exemptions, and they're March 31st going to go by. They are not going to have people paying up. Look, there's a story in the Journal today. The IRS can't even collect this stuff. They'll never get the right information. They're going to waive that too.
Affordable Care Act, Larry, is the biggest oxymoron of the year.
I give you the last word, Avik. Obama killing the individual mandate.
I think what's really important is we're talking about these enrollment numbers, 5 million people supposedly signing up, who's paying, who's not. It looks like about 3/4 of the people who've signed up are previously insured people.
Yeah.
Who actually among the uninsured is going to pay, who's 25 years old or 28 years old or 32 years old, is going to pay $4,000 for an insurance plan when they're perfectly healthy? Nobody. They'd rather pay that fine.
Unbelievable. All right, gentlemen. Many thanks, Dr. Bill Grace, as always, and Avik Roy and Steve Moore. We appreciate it very much.